सर्वांना नमस्कार. आज पाहता पाहता पाचवा आणि शेवटचा सेशन या सिरीज मधला आलेला आहे. आणि डॉक्टर राऊतांनी आपल्याला अनेक गोष्टींविषयी ऑलरेडी सांगितले. आणि आजचा विषय आहे, विशेष म्हणजे नर्चरिंग विमेन्स हेल्थ विथ आयुर्वेद. थोडंसं मागच्या विषयाचं कंटिन्युएशनच म्हणता येईल, पण दिस इज मोर स्पेसिफिकली फोकस्ड ऑन विमेन्स हेल्थ. तर मी आता डॉक्टर राऊतना रिक्वेस्ट करतो की प्लीज टेक ओव्हर अँड स्टार्ट युअर सेशन.
Thank you. Thank you so much. It's always a pleasure to be with you on this. And this lecture series have been going on for last 6 months. And every time when I meet, I really truly enjoy, presenting and having all these inquisitive minds and questions. And so we are coming to this very important session today. And before even I start the session, I want to wish everyone happy Heart Day. I'm sure you know this is a global Happy Heart Day, and the more important about the Heart Day and today's topic is in two aspects. Number one, heart is uh, you know uh, is a feminine organ. That's what it has been understood, and we are talking about the femininity, and we are talking about the woman's health. So that way, heart is important. And the second aspect is, and this is not really a maybe good aspect or from the, I would say, I I mentioned first aspect as a power of a woman's heart or the niceness and as I said, the heart considers the love, all those aspects. But from the disease perspective also, unfortunately, in United States, the number one disease and in female, which is seen more in female, and that is heart disease. So the health perspective, we need to understand thoroughly how women should be treated or how she should take care, not just the treated. In Ayurveda, we don't believe in only treatment when disease occurs. We pretty much believe too much, or maybe the main aspect of Ayurveda is always a prevention. As if you recall, in very first presentation, I've mentioned that what is Ayurveda and what is Ayurveda's aim. And I had told you in a verses that Swasthya Swasthya Rakshanam and Aturasya Vikara Prashamanam Cha, which means again the one who is healthy, protect, prevent, and persist that health. How do we enhance that health is the first aim of Ayurveda. And then if you fall sick for many reasons, it can happen, then of course Ayurveda is there. So with that background, let's start understanding that how really do we look at woman in Ayurvedic perspective. I'm not just talking about a one particular female or one particular, I'm talking here about the whole femininity. And the whole femininity is considered as a shakti. I know many of you are very well aware of that now. The Ghatasthapana will happen soon as October comes closer. And we call it as we celebrate the Navaratri. What is it all about? It is all about that femininity. It is all about that energy. It is all about that shakti. And that's exactly the shakti which I'm talking about. And that's how Ayurveda perceives this women. And this, as I said, it is a feminine energy. Why it is shakti? Because it has that power to create an identical person, like a human being, a complete human being. To creation of that complete human being is God has given that to females or the women, and that's how that it becomes a shakti energy, feminine energy. And another very important aspect, that this feminine energy is actually the origin of all creations. If you again recall, in my first presentation I have mentioned this, that prakriti, we call it as mother nature. Prakriti means mother nature, right? And mother nature is the nature. Why do we call it as a mother? Because it is a absolutely from the mother nature, the whole creation had happened. In Ayurveda has the 6 strong darshana shastras, and one of the darshana shastra, which are considered as a foundation pillars of Ayurveda. And one of the Darshana Shastra is considered as a Sankhya Darshana Shastra. And I'm sure many of you are aware of this Sankhya Darshana Shastra. There are other remaining 5s are also there. Vaisheshika, Nyaya Darshana Shastra, Yoga Darshana Shastra, Mimamsa Darshana Shastra, and again Uttar Mimamsa or Vedanta, where the Advaita is being considered. And in Advaita also, the same aspect is considered, that the Purusha and Prakriti ultimately creates, Prakriti becomes the, who has that ability to become from one to many. And that is also considered a feminine energy. And that's how Ayurveda looks at the whole concept of feminine energy. So, having said this, now let's take a look that what is that uniqueness that woman has. Other than, I mean, if you compare then male, then obviously the anatomical structure is different. The physiological structure is different. The pathology also happens many times differently. As I said, in certain diseases, women suffer more, right? The heart diseases, for example. Why all these things happens? And well, not just the physical or physiological or psychological. Of course, psychologically also women are much different. They are more sensitive, and emotionally also they are different than males. But more than that, they have sometimes more intuitiveness, and all these things are distinctly different in females, and that is their uniqueness. And this uniqueness, if you would study and if you see, there are like a statistical data I would like to show you. Not just I'm saying this gender difference in the basis of physical and psychological and all thing, but if you would see the statistical data, actually report shows that, and I'm talking this statistical data more regarding to the healthcare system, again health perspective, right? So it has been shown that women are more aware of illness, and they are more aware, and that's why they kind of like they go for the aspect, they seek for the more help of the healthcare, and they do go in the earlier stage of the disease also. So they intuitively know something is wrong in them. Relatively, I'm talking about their counterpart, male. And they also seek more help for the healthcare. They actually request more communication. What does that mean is, and it is also been mentioned that otherwise also female needs more words. They use, if male uses 3 words, then actually female uses for the same communication to happen 10 words. Well, I don't know whether it is good or bad, but what I would really want to tell you that how positively it is important from the healthcare perspective is, it requests more communication, in the sense they are, the women or the females are more inquisitive about their illness, and they ask many questions to their healthcare professional, that why this, why not this, how this is not this. And that means the request more communication. They also report much more symptoms, and this is very very important. Being an Ayurvedic doctor, I could definitely tell you that this is extremely important, because how much in a patient and doctor relation, how much patient really says about what is that person is suffering from, it solely depend upon that. I mean, that's, if that person is have the ability, the patient has, if patient has that ability to report the symptoms correctly, then it becomes so easy to do the, to obviously to do uh, the whole diagnosis ability really increases. Doctors diagnostic ability increases. And so this is what was the main aspect why I brought about this aspect is to tell you that women are unique, and that's why they need a unique healthcare system. And what that healthcare system they would really want, then I would suggest, all these bases which I showed you earlier, that that healthcare system which really incorporates, number one, is self knowledge, which would be able to give self knowledge, or which has the ability to educate you about the self knowledge, or basis on that which the diagnosis can be done. Then the second thing is nature's healing resource. And as you know, of course, Ayurveda, the whole treatment approach, what we do in Ayurveda is absolutely nature's healing, from the nature's perspective, not just observing the nature, but any substance which we use for the treatment is absolutely natural. Then it would morely female unites the body, mind, soul, because they so much believe in integrity completely. And that's how the holistic approach is being more preferred by females. And again, Ayurveda provides that. And it also serves on a deeper level of health. It, again, healthcare system which serves on the deeper level of health, which let me explain you this little further, that a healthcare system which not just provides the physical aspect, but it is united in the level of psychological aspect as well as emotional aspects. That is being more preferred by female. And of course, I would say Ayurveda is definitely that. And females are more sensitive to the rhythms and cycles of the nature. And as I again mentioned during the Dinacharyas, the second lecture where I was talking about the balancing lifestyle, and I mentioned that how the nature's rhythm change, and that's how our body changes. And that is what exactly Ayurveda has always been seen and observed and profoundly mentioned, that how do we put that in our daily routine, not just daily routine, but also the seasonal routine. And Ayurveda is the one who really provides distinctly the seasonal routine also. So not just daily routine, not just nightly routine, but the seasonal routine. And the whole intention of Ayurveda is always to attune yourself with nature. And that's exactly everything is there in Ayurveda. And that's how I think Ayurveda is really a good fit for women's health. So now that we have come to this aspect, I want to talk about one of the, of course, the different women's health perspective. When you're talking about, obviously you want to know that there are different stages of woman life, and these different stages can be really, if we see and someone can see and just say, oh yeah, this is like the age related. Yes, it could be age related, but more than that, I would say it is actually hormone related. The childhood to puberty, again, the hormonal change, and then from puberty to maturity, when menstruation starts, but then really the childbearing age comes. So that aspect of maturity, or that aspect, again, as that comes pregnancy, there the hormonal change would happen. Then post uh, natal, which means the post delivery, after giving birth, again the hormone changes. And then a age comes where the now the reproductive health starts ending its function, and that perimenopausal age, and ultimately menopause hits. But after menopause hits, it's still in the ride of balancing hormone, because there is a huge change comes, and then it gets settled down, and then again a wise woman. So this is how the different stages of life, and Ayurveda has absolutely provided for the each and every stage how women should behave, act, eat. Everything is being absolutely given. I would like to give you one another maybe question to you. This is a question to you. And before I really start the subject, I want to ask this question to you, all of you, and those who are here, and those who are, watching there on Facebook or direct relay, wherever it is happening. I would like to ask you this question, and if it is possible, do you think prevention is better than cure? Anybody, you can unmute and maybe just tell me.
Yes.
All
Yes.
right.
Of course.
Of course. And you know what? I would say prevention is not better than cure. Actually, prevention is cure. Remember, this is a very strong statement. We just say that, oh, prevention is better than cure. But do you realize that prevention is cure? Because if you really prevent that, the disease will not itself happen. And that perspective is extremely important in Ayurveda. That we don't even allow the disease to happen. And it's not just that I'm just saying, but I'm going to give you a whole concept here, what we call it as a paricharya concept. So there is a whole lot of paricharyas given. And what is this paricharya? So this is a whole concept Ayurveda provides. And this is given in the perspective of how we prevent that all diseases. As I already showed you, that there are so many stages of women health will happen. And every time this hormonal change will happen, as change, all changes are difficult, always how you take it. And so knowing those changes in body, certain do's and don'ts are recommended, where they would be from the dietary perspectives, or they could be from the lifestyle perspective, or certain modifications are given. And all those protocols, which we could say, or maybe another word could be regime. So all those particular regimes which are given during the women health, during the all cycles of women's lifestyle, women's stage of life, those are called paricharyas, and these are very unique approach which Ayurveda gives. And I, at least, maybe my knowledge is not complete about the rest of the healthcare professions, and there are many healthcare modalities, but I don't really, at least I haven't not come across any of other modalities. And if there is great, but at least whatever I know based on my limited knowledge, at least I don't think any other, or I haven't read any other medical modality which really focuses this concept of paricharya. And as I showed you so many stages, the same way these different stages are truly given for each and every aspect of these paricharyas are given for these and different aspects of the stages. And it's fantastic, it's mind-blowing sometimes to see that how they knew this. And nowadays, when we actually do the further evidence-based approach, actually it shows. So one of the, let's start with, and obviously if I have to start with, I'm just starting with the Rajaswala Paricharya. So what is Rajaswala? Let me talk about the Rajaswala first. And if I show you the picture, maybe you would get it, the Rajaswala approach. And yes, if you could get it from this, it is about the menstruation. So Raja means menstruum, and Rajaswala means who is in menstrual cycle, who is menstruating. And so the female, of course, as I said, as adolescent comes, the main hormone change happens, and really the female child becomes now that way adult, and she becomes she starts menstruating. And for that change, that every month, whatever the change is being coming, for that certain things have been recommended. And that is what is called as a Rajaswala Paricharya. And I have given in a very short aspect here certain things, and these the reason of showing this picture is because I really see in my practice a lot of females. I practice in a my I have two practices, and one practice is actually in a town where there are two universities, so we really have many young female students who suffer actually from PMS, either or premenopausal, premenstrual syndrome, or maybe just painful menstruation. And many times they are not able to go, and then they. The funny part is they sometimes feel that that is routine, that is how it is. And when I tell them that, look, that is not the case, you can be absolutely without pain. It is possible to be without pain. Sometimes they are surprised. So, my point is it possible to really be without pain during menstruation? Then it is yes. And there are medicines and there are Ayurvedic treatments, but I'm not really going to go into those treatments. Because I'm committed here that prevention is better than cure, or the prevention is cure, right? So obviously, there where I'm saying, that's why I want to put this complete new topic of Rajaswala Paricharya. Paricharya is again do's and don'ts, what you are supposed to do and what you are not, on what you are not supposed to do during that particular period. So those that treatment that sorry, not treatment, but that regime or that lifestyle protocol is that paricharya. And so what it has been saying that menstruating women should eat light meal. Now, obviously, according to Ayurveda, the all answers I will try to give you, and there are certain studies which have done that whenever menstruation is happening, according to Ayurveda, again, it is the Vata, which is has, if you recall again, the three major bioenergies, and one of them is Vata, which is responsible for all sorts of actions, movements, things when move from one place to another. That's what the bioenergy Vata does. And obviously, it is more in the aspect of a downward direction, and that's the reason again it is recommended that you should not be putting a huge food item where the disruption of menstruum, which is supposed to be go outward, can be disturbed. It is also mentioned to observe the celibacy during that period of time, and now it has been evidently shown that the pH of uh, the whole reproductive area there is kind of sometime should not become acidic or should not be more exerted, and that's how that can create the effect on the menstruum. This has been studied, and again Ayurveda already talking about the observing celibacy. Then to eat directly through the leaf or the clay vessels, here is the another study done, and they have observed that why the clay vessels. The clay vessels, is made up of clay, which has obviously tendency of absorbing too much spices. If there is a spicy food or acidic food, that gets absorbed, and otherwise also avoiding pungent and spicy food has been recommended. So clay vessel has this ability to absorb that, and on the top of it, the clay itself made up of multiple enzymes and I mean to say multiple uh, the
Ingredients.
essential ingredients or micronutrients, which we call about, that can also help there, and that may be the reason why they were recommended to do eat from the clay vessel. The another aspect is to not to do during the daytime, and again according to Ayurveda, the daytime really disrupts your kapha is a bioenergy again, and that can lead to unnecessary weight gain, and that may be the reason. And on the most important thing, I think it has been very clearly mentioned not to perform any strenuous activity. Many of you might have known and heard this, and in that maybe like 40 50 years ago, people used to really follow that if you are in the menstruation, then do not go enter even into the kitchen. That was a cultural aspect, and people many times used to think, oh, this is just the, all these sayings, and not like there has nothing. But truly speaking, if you really look at it into it, that strenuous activity can disrupt or again the hormonal imbalance, and we do not want that to be happening. And that could be the one of the reason that avoiding the strenuous activity is being said. Avoiding use of scents, there is another aspect to this, and it's a further very deep thing. It has been considered that during the menstruum, females many times secrete some kind of um, toxins, not just the toxins as a that how there is a particular name. It's not getting to me now, but uh, it will come. And so those things can actually interfere sometime with these. Uh, they can be actually uh, openness. It creates the more susceptibility to the diseases even. So to avoid everything and just to keep away, and not to particularly in mix in someone, that's how also the keeping it away has been said. So these are just the certain aspects of, just to give you an idea of like how Ayurveda has taken. And again, there are many other how what to do even before that, and although that comes if you are suffering from any aspect of PNS. So that is totally different, and the disease management is different. This is just a preventive management. After the Rajaswala comes the Rutumati. So, what is the Rutumati? Rutumati is that exact phase where the ovulation has not yet happened, but menstruation is done. And that is also very nicely mentioned. And we know that the estrogen levels are high, and in general, the whole period is aphrodisiac for the female, and it because it is all the preparation for the obviously the whole preparation is meant for having the child, if conception happens. And that's how the Rutumati Paricharya is also being given. One of the very important, the 16 sanskaras are mentioned in Ayurveda. And one of the very beginning of sanskara is Garbhadhana sanskara. And that the Garbhadhan sanskara generally happens, and I don't know, many of you might have heard about this Garbhadhan sanskaras. And that Garbhadhan sanskara is actually done during the Rutumati Paricharya. Again, all obviously, it's not that every month it is been done. It is in certain time only. Many times these things are being even forgotten now from the system, because the nuclear system, family system has developed, and people don't even stay with their parents. And this is something more the rigorous activities, and there are certain shlokas, and certain things are being mentioned. But I just wanted to share that Rutumati Paricharya also leads to one very important concept, which I want to share with you. And that concept is very important, and that is called Suprajanana. So, what is Suprajanana? The word is made up of two words, Supraja and Janana, which means Supraja is the obviously the child who is going to develop, and it's janana, it's that means it's development. So if I have to just translate in a simple word, then it comes as a radiant child development. And this is truly important, and this is very fascinating, and you might have heard also this, but Ayurveda gives most importance for this subject. And you may think that, okay, child development means now the child is born and now the pregnancy is done and then we have to do something. Then that is not really the case. It is actually preconceptionally how the things are to be made that is being written. And that's why I said the whole concept of Rutumati Charya and Garbhadhan Vidhi. So Garbhadhan Vidhi or the Sanskara actually happens preconceptionally. And how the preconceptionally uh, husband wife should be, that is also being recorded very well. In fact, how the bija shuddhi should be done, how the how that the male as well as female in that pair should really undergo a extensive cleansing process, which we call it as panchakarma. And you have heard about panchakarma, we just and that is called Ayurvedic detox. And this whole Ayurvedic detox is recommended. And I really don't like a detox, just Ayurvedic detox word, because Panchakarma has a much more depth and much more vast approach, and much more, what we call it as the it would give the much more results. But however, panchakarma can be done when you are completely healthy. And even the baby is not yet born, the conception is not yet happened. Still, certain things are recommended for the both the couple, both the partner in the couple. And this further again divided into two parts. So Garbhadhana Vidhi Sanskara is one part, and then comes the how do they prepare themselves, that is the second part. And then actually comes the same night when the actual unity is going to happen, and actual conception going to happen. And I want to tell you, and you may be surprised, that literally how what should be the color of the room is from that much details are being given. Or how do you approach what would you eat, and how that is, everybody knows that Ayurveda will definitely tell that what you should be eating during that time, and what you should be drinking during that time, that has been mentioned. But how do you climb even onto the bed, and which part of bed a female should be, and which part of bed the male should be. And not only that, that which mantras to be chanted during that time. I mean, absolutely details are given. And with that, how you invite the fetus to be in, that is also mentioned. It is absolutely needless to say that suprajanana is, that's why the whole aspect, that means it really starts from conception, it goes with the whole pregnancy, and of course it goes with the after child is completely born, and what has to be done. So this is the whole all aspect. And you can definitely guess from here what I'm trying to tell you, that it's not just the we are talking about the pre-pregnancy diet or something, but it is much more than that. And of course it is not just the postnatal treatment approach, but it further goes beyond that, in the child development stage also. So obviously when we are talking about suprajanana, and as I said already, the preconception, which is the rutumati kriya, rutumati paricharya. So the next paricharya comes is a garbhini paricharya. uh, so the word Garbhini stands for pregnant women. And so the one who is now pregnant, right? And so how she should be actually acting, or what diet she should be eating. And again, it's a many times people think that, oh, we're talking about diet means you have to eat more calcium and more iron and more. So I'm not really talking only on that. That is great, that is definitely good, that one should must have. But I'm really talking about Ayurveda's approach of giving the food as a medicine. And this is something very crucial to understand, that even in Ayurveda, there are unnecessary herbs, even herbs which are very, very soft, very, very safe. And still, those are also protected. those are protected means they are avoided, that okay, even in that stage you should not take anything. And so what should that women, that what that garbhini or the pregnant lady or pregnant woman should take is being given in the perspective of dietary aspect. And so every month what she should eat, certain specific food item, is that dietary regime I'm talking about. Of course, avoiding certain tastes or too much eating certain sort of taste. So, for example, it has been mentioned very clearly that if during that period you eat, a pregnant lady eats a lot of salty food, then it is likely that the generation, the kid or the infant which is going to born, and then his lifestyle, like not just now but later on in his life, he will have the khalitya and palitya, which means he would lose his hair early, or the hair would turn gray early. It is also mentioned that he may have the eyesight's problem. And there are many other aspects also written, and this is how it is written for the every taste. Ayurveda believes there are six tastes, and if you eat too much sweet, what will happen? If you eat too much sour, what will happen? If you eat, so all these things are very clearly mentioned and specifically kind of warn to that female that how balanced lifestyle you should be living during that time, because that is the most precious time, because it's not that you are living but you are, bearing a next generation in you, and that's why it has been mentioned. The same way Ayurveda believes a lot in color therapy also. And there are certain specific colors which are mentioned, have mentioned that which one should absolutely avoid these colors. And these colors, one should not wear those kind of clothes even. There are many do not to do lists are there, like how high heels should not be worn, or you should not be sitting in a any kind of a vehicle which would have a bumpy ride. And some are absolutely easy to understand, that how much care is being taken to avoid any kind of any kind of a pregnancy termination. But there are many other aspects also, and such in a detail these aspects are pointed out and written down. Talking about the yoga during pregnancy, I don't think really that I have to even talk about this. The reason behind that is, uh, I'm sure, at least in US, I mean almost all yoga studios most of the time would offer the pregnancy yoga unit. And we know all how much it is important. As I would, I have some even the data to show you that how much it really helps performing yoga, and not just yoga, performing the whole Garbhini Paricharya, or the whole, again, Garbhini means pregnancy, lifestyle, diet, and lifestyle when it is mentioned. How would you see the difference? And I think I have a slide where, we call it as a Garbha Samskara. So a study was done on the 215 participant, and I know it should be more also, but this is a very simple study done, and they found that when this Garbha Sanskar effect, so again, Garbhadhana Sanskar and then Garbha Sanskar are little different than both of them. So Garbhadhan is done in Rutumati, that means before the conception happens, and then comes the Garbhini Paricharya, which again goes from the Garbha Sanskara, and Garbha means fetus, and Sanskara is again um, certain vidhis, certain things which certain protocol which is been specifically mentioned for enhancement of fetal health. This is simply mind blowing, because now the more and more studies have been done, they are really showing, and Ayurveda has said this way long before, that fetus really starts listening, and it really listens way early. So in the fourth month, and in fact every stage, every month, what of fetus develops, what fetal development happens, has been given. And accordingly, the recommendation is also given, and that whole 9 months recommendations are called as a Garbha Sanskara. And when these sanskaras were done on these pregnant women, and then their all aspect has been seen, then it gave the effect on them also. So not just, so here in one aspect, we are not just working on the pregnant lady, right? But we are also working on the fetus which she is bearing. And that fetus is being developed not just the physically, not just the physiologically, but the psychologically, and more into even emotional. It has been seen, and there is a very big uh, institute which is called Manashakti, and you might have, many of you might have heard about that, and it is based out in between Bombay and Pune, in between there, and they have Swami Vidyananda was the founder of that Manashakti Kendra, and they have further have a huge study. I mean, of course, Garbha Sanskara has been mentioned since long time, but they really took that up and studied much more and developed many, and then they have even presented these things here in US also. So all these, has always shown that how much it really helps the frequency, how many people would have those frequency, and when that situation was there, that stress was high, concentration and were high, and then they really saw the 97% of the effect. As I was telling you, one of the Garbhasanskara is actually a musical therapy. And so I'm sure you definitely are aware of that. The Indian classical music has something which is, we call it as, those classical notes are called as raga. And you might have heard about these ragas also. So Asavari Rag and Kedara Rag, or also these both rags are actually mentioned to increase the Oja Vriddhi. Again, if you recall, in last presentation, I talked about the concept of Ojas. And this Oja Vriddhi, this Ojas, how do we increase these Ojas in the fetal life? And that's why these musics are used. And as I was saying, again, the Manashakti has done a huge research on that, and they have like almost more than 50, 60 years of research. And they have developed certain series also, and those ragas are being played, and they have observed how the fetus development happens, and how uh, again, this development is not only for the physical aspect. This definitely for the physical aspect, but this is more than just the physical aspect. So that has been seen. And as I was talking about the yoga, again, musculoskeletal status by just performing yoga has been seen. So the back problem was there, then that can be, very, very helpful in back problems. Then muscle strength was increased, the joint problem, it was helpful in joint problem, as well as even abdominal flexibility kind of increased, work stress decreased, and again, all type of postural flexibility was also developed by using the by using the yogasanas or the yoga poses. So as we come from the pregnancy, obviously the delivery now has to happen, and then comes the postpartum period or the postnatal period, and that is known as Sutika Paricharya. So I want to tell you one very exciting aspect here, that in general, if you would see the postnatal phases, then in the contemporary science there are three phases are mentioned. And very first phase is acute phase, then that is the first 24 hours after the delivery of the placenta. This is very important to note, that the placenta uh, has to be delivered, then only you are called as a Sutika. And you may say, oh, what's the big deal in that? But look, even at that time, thousands of years ago, all the Samhitas, all the main textbooks of Ayurveda are also says the same thing what we believe today. So it is absolutely these phases are considered in on the basis of that, and each and every textbook says that yes, only believe the postpartum starts when the placenta is developed. And as a if you have this, I mean, you might have definitely heard about this, that how much it is important, not the baby to come out, but the same amount of importance is that placenta has to come out. And then really we say, oh yeah, now the delivery is complete, because now the female is out of danger. Otherwise, sometimes placenta gets stuck and she bleeds, and sometimes even death can come. So that's how the first acute phase is considered. And then the second phase or subacute, like early phase, is up to from 7 to 10 days or 2 weeks, when the actual uterus is starting to contract and bleeding is still happen. And then comes the third phase, which is called delayed phase. And this delayed phase can be up to actually 6 weeks to 6 months. So 6 weeks, why am I saying again 42 days? How these 42 days, Sutika or the postnatal woman should behave has been mentioned. So this whole period is called as a Sutika Kala in Ayurveda. And then the Sutika Paricharya means how she would behave in the first acute phase, and how she is supposed to be doing in the second acute phase, and how she should be behaving and what she should be eating. And it's the whole aspect is very wonderfully written and very apt and very doable and very practical. And I've seen again it helps a huge amount. And it's not just many time people don't use that and then they suffer later on. So Sutika Ahara is a big, I'm sure everybody here is very well aware of that, after delivery, what to eat and what not to eat, and how much importance is given to it. And so, in a short, if I have to say what are the diet principles that's been used, then the very first thing is been said that Laghu Snigdha Ushna Hitakara Bhojanam. What does that mean? That means the diet should be light, but it should be still unctuous. It should be always warm, ushna. They has to have the a nice heating properties, and it should be hitakara completely. That person should not don't give ushna means something very spicy. Absolutely not in that sense. So it has to be hitakara also, which is very very good. Again, it should be light to digest, warm, unctuous, and wholesome food. And food preparations, how to do food preparations, they that is also been mentioned, and that is a part of ahara chikitsa. This is another very important aspect that I would like to focus on, that how Ayurveda is always given, which ingredients to be made eaten, how it should be eaten, how to make, what should be the recipes, that has also been given. So it's not that you just eat this food and this much calories and this much amount, but further details are also very much given, and then they proves. I have just this. I know we have little time, and I have to cover a lot, so I'm not going further in detail. But I just wanted to show you that these are the some very very important. I mean, I think everyone would know the shopa, and then the vidanga, vowding in Marathi, and ajwain is ova in Marathi, and uh, kushmanda is white pumpkin, and then shunthi is suntha. And literally, look, these are the very common household herbs which are used during the postnatal period. And I have this all pharmacological properties, and they're actually establish actions. So these are validated in the sense there are studies done, and these things have been shown that how it is, how it increases the tryptophan specifically. And as you know, tryptophan is the again precursor for serotonin, and that's how the rasadhatu according to Ayurveda increases. And the postnatal period is also, you might have heard about the baby blooms, right? And those depressive period can come, and how that has to be kept up properly. And for that reason these other things are being really recommended. So I'm not going to go in each of every, but I just wanted to give these things. And one another very important aspect I wanted to tell you about Vastu. Again, what is Vastu? Vastu is the uh, I mean, I should not say this way, but because the feng shui is very popular, and that's why I'm saying it is a Vedic feng shui. Of course, it's not a right translation. But because this popularity of feng shui, that makes me to say this. Again, Vastu is the more appropriate uh, definition would be the Vedic architecture. And you would say, why this suddenly Vedic architecture are you talking about? Then I wanted to just tell you that Sutika Gara was explained in these Samhitas, which means how do you prepare the aseptic room for performing this, and what even amount of wood should be used for creating this, and it should be that those in like 10 days that women should stay in that Shutikagara, and how that it should be facing the east door, and how would which like which herb should be stored there, and all these says that how much they were very much aware of this fact that this is the very vulnerable time for female, and it is very likely that she would get the infection, and it is very likely that she should be protected, and that's why this specific room is being constructed next to the house, and then it can be destroyed also. So where how many doors should be there, and how many I mean, you just think about it, that how depthly it has been, how what is the depth of the understanding, and how it is the depth of the care which is being provided. So after Sutika comes the Rajo Nivrutti, of course, menopause. Now the childbearing age has been done. And again, the time that reproductive health is going to go away. And reproductive health, I'm sorry, I'm not going to say the reproductive health, I want to say reproductive functions are going to come to end. And that's how the time, which is called menopause, known very commonly known as menopause, because men says pause, now it is not, that's why it is called menopause. But look what Ayurveda says, it says rajo nivrutti. So they could have said, rajo stop, or rajo anta, or something like that, but they chose the word rajo nivrutti. So rajo means menstruum, right? Rajaswala. So that is how Rajo means menstruum, and Nivrutti means retirement. So, according to Ayurveda, the Rajo, there is no specific treatment modality given for the menopause. This is a most interesting part, because they strongly believes that this is just a natural process. This is absolutely a natural process, and that's how it comes. And it there is nothing wrong in it. And obviously now we believe also, and there we know, this has been very common knowledge now, but at least around 50, 60 years ago, this was still considered that suddenly estrogen drops and you need really the estrogen, and people used to give the hormone replacement therapies, and so many things used to be done. But now it has been accepted completely as that, okay, this is a normal thing for the body, and nothing really, not to really worry. And of course not worry, but still people suffer from so many things, and that creates the further problem. And how to deal with that, of course Ayurveda has given that protocol also. There are always two sets of protocol generally been recommended. Apatya means don't do, and patya means do. And general typical protocol could be really avoid too much heavy isolated protein food, spicy food, and then the pumpkin seed, meat, shellfish, one should be keeping it away. And again, depending upon what kind of problem is happening, many times people suffer from hot flashes, and night sweats, and that sorts of time, then that can be utilized. And if that is the problem, general recommendation would be, and why I'm saying hot flashes, because again in US, if you would see, the statistic shows that most, like, at least 50 to 60% of female who are suffering from menopause will have the number one symptom would be hot flashes. And so I'm giving here some quick tips for those hot flashes. And the if you are suffering, then maybe simplest thing, just take a pomegranate juice, maybe half ounce, maybe one-fourth cup, and just add 5 drops of lemon juice, and just take it twice a day. And what for the food aspect, maybe eating wild yam 4 to 5 times a day would be really helpful. And now there are like many, I mean, this is again a common knowledge that estrogen kind of like goes down. So there are many Ayurvedic herbs which really are, which has, or even food aspect like wild yam has the phytoestrogen. So what are these phytoestrogens? Phytoestrogens are the uh, defined as the completely natural form of estrogen, which are really not very strong as a synthetic estrogen. It is a weakly born estrogens, and most importantly, they are very they follow certain pathways, and they have certain receptives there. And these phytoestrogens are why they are good, because they many times actually will more helpful for the way they are, they have these receptors and they unite with this receptors on the body, are mainly on the bones and brain and the skin. And so that way they maintain the good health of these areas later on the life when the actual estrogen drops. At the same time, they have the negative approach for the breast and the uterus, so they do not really increase and make them high and create. So they that way they protect the cancer aspect also. So that's how there are many such simple remedies which you could think about during the menopause, and something simple. And many times another very popular after like in during the menopause, one of the, as I said, hot flashes. And then second aspect is the anxiety. Absolutely, anxiety depression is another very popular symptom which you would see. And what one can do, these are the very easy simple remedies. I would recommend something as simple as, apply the abhyangas. This is the right time to do the full body massage, the oil massage. At least once a week one should apply that to full thing. And maybe have some milk which would have the nutmeg and saffron. And if you have really an almond also. And if there is a, because of anxiety, if you're not able to sleep, then adding nutmeg is a very good idea. There is a mudra, kamala mudra, which you are seeing here. Doing that actually opens up your heart chakra, and this whole anxiety aspect can go. There could be again marma point massage on the body can be done, and can be useful. The best way to do the shodhana, the pranayam, which is a breath work, and nadi shodhan pranayam is the one of the very important. So, which is also known as alternate nostril breathing. That can be done, and the best way is to do the meditation. And I mean, you have heard many times from me that how the Soham meditation really helps, where you release what you are and really try to become one with the universe. And that's why, that's how it really helps. So I know I am exceeded my time a little bit, but thank you so much for your patient listening. And I think I will open the uh, floor for the questions. Thank you so much.
थँक्यू व्हेरी मच डॉक्टर. कोणालाही काही प्रश्न विचारायचे असतील तर विचारा. ठीक आहे. आणि
राऊत, मी वृंदा कुलकर्णी. नमस्कार.
नमस्कार, बोला.
वाईल्ड याम म्हणजे मराठीत काय? वाईल्ड याम.
मी तुम्हाला मराठीत सांगण्यापेक्षा इथे काय मिळतं ते सांगते. जे आपल्याला आपण ज्याला हे म्हणतो ना, स्वीट पोटॅटो म्हणजे
हो, रताळ.
पण रताळ जेव्हा लाल असतं ते स्वीट आणि आतून पांढरं असतं, त्याच्याऐवजी जेव्हा आतून केशरी असतं, दॅट इज वाईल्ड याम.
म्हणजे जे स्वीट पोटॅटो आपल्याला मिळतो तोच, म्हणजे नॉर्थ कॅरोलायनाचा जो स्वीट पोटॅटो इथे मिळतो ऑरेंज कलरचा.
ऑरेंज कलरचा त्यालाच वाईल्ड
त्याला
याम म्हणतात. येस,
अच्छा, ओके, धन्यवाद.
शुअर.
Tofu also has a phytoestrogen, right?
Yes, yes, yes. Tofu also has the phytoestrogen. And tofu can be used more than tofu. However, tofu is considered little processed. So, if possible, use the edamame. That would be further better.
Right. But do you have to consume that for a huge amount, right? Or
Well, yes,
much?
not depends upon what why you want it and how you are using it. Or another aspect is to frequently using it, right? Like take it as a that's why there is a whole concept what we call it as a food as a medicine. Like take it regularly, maybe in a small amount, but take it regularly, and that can help.
Okay.
चला डॉक्टर, थँक्यू व्हेरी मच. पाहता पाहता आपले सेशन संपले. म्हणजे ही सिरीज आय एम शुअर वी आर गोइंग टू डू इट अगेन. नो क्वेश्चन अबाउट दॅट.
Yes, yes.
आणि 2-3 गोष्टी आपण सगळ्यांनीच अनुभवल्या, नॉट ओनली टुडे बट ऑल द 5 सेशन्स. आजच्या सेशनच्या सुरुवातीला डॉक्टर राऊत सेड दॅट विमेन हॅव सम युनिक कॅरेक्टरिस्टिक्स, आपण ज्याला शक्ती म्हणू किंवा काही. आणि आपण आता मॉडर्न मॅनेजमेंट रिसर्च पण जो पाहतोय गेली 20-1 वर्ष, की इवन दो ट्रेडिशनली management and business has been considered to be the forte of men, women are becoming increasingly successful. आणि मॅनेजमेंट सायंटिस्टनी किंवा इव्हन सायकोलॉजिस्टनी वगैरे मुख्य त्याचं कारण असं सांगितलंय की विमेन हॅव मच बेटर एम्पथी. आणि इफ यू लॅक एम्पथी then you can only control people with your authority, but you can't really motivate them from inside their heart to do what needs to be done. And that is where it has been said that women have got a better potential to become leaders. So that was one thing that came to my mind. And the other thing is this whole integrated approach that we see in Ayurveda. Ayurveda, the word itself, it's the knowledge of life. They could have called it Chikitsa Ved, if they wanted to restrict it to only treatments and healthcare and disease care kind of approach. And even while Ayurveda itself is highly integrated, it is also completely integrated with the whole Dharma Shastras that we have. It connects with everything, food, music, Vedas, and that integration or that wholeness is something that we have to appreciate, and that can give us much better results. I am going to appeal to all of you that you have experienced what Dr. Raut brings to us. So if you have got any groups, senior citizens, young women, men, or general community groups, and if you want to invite Dr. Raut for a lecture appropriate to that particular group, please feel free to do so. I will be also happy to help connect. And let us keep this dialogue going, whether it is one-on-one that you want to recommend to somebody, a young woman probably who is, entering into family life, or any other people who need help enjoy their health in a better way, so that we can keep this dialogue going and continue to get engaged with Dr. Raut, because I have seen her work and passion for last 25 years, and I would be very keen to see that she continues to remain engaged with our community. So with that, Doctor, I thank you very much, and we will be coming back to you.
Dhanyavad. Sure. I'll be happy to always. It was a absolutely pleasure to be with you all, and it's an honor also to be here. So thank you.